I'm going to present to you a case study which is called One Small Cut That Killed. It is about Dr. Contadina, who is a primary care physician in a metropolitan area at a large not-for-profit integrated healthcare system. On average, she sees several patients a day from a variety of backgrounds who come in with an assortment of conditions, injuries, and ailments. One day, a patient comes to her complaining of ankle pain on his right leg. The patient is a farmer, and he says that he fell while he was taking care of his chickens in his chicken coop. He has some cuts and bruises on either leg and complains of a swollen right ankle, but appears to be fine right now and in no acute distress. This doctor instructs him to purchase an air cast at a pharmacy along with some ibuprofen and to take it easy the next couple of days. And then Dr. Contadina returns to seeing other patients and Joe goes home. 3 days later, Joe is admitted to the emergency room. He has a low blood pressure, a fever, extreme shaking, an irregular heartbeat, and is very agitated. After removal of the air cast, the nurses notice a cut that has become infected on his left leg. This is the opposite leg of the swollen ankle. Joe's condition continues to worsen, and he eventually goes into septic shock. After 2 days in the ICU, Joe dies of complete organ failure. The family wants answers, and so far all they know is that he came in with one small cut and suddenly died. The hospital is pressuring Dr. Contadina to apologize in hopes of mitigating some legal trouble. Dr. Contadina is afraid that if she admits that there was any chance she made a mistake, that she'll be in bigger trouble, both legally and professionally. She is very afraid of what her colleagues and patients will think if she admits that she has made an error. As the administrator of the hospital, I would have the physician and myself explain what was going on with the patient and apologize for what has occurred. I think that there are a lot of risks and benefits that come with admitting the physician's and clinic's faults. The risks are that this could lead to the physician losing their license, or this clinic could be sued due to malpractice, patient abandonment, or start litigations for prematurely discharging this patient from her care. I think that it is important to show accountability, inform the patient's family of every detail, and show remorse. This could be a benefit. I feel that when patients' families are informed and given an explanation behind their actions, they are aware that everything possible or any treatment could have been done to treat their family member. Overall, I do not think that the doctor meant to do any harm, which is non-maleficence. The doctor could have been slammed in a clinic that day, especially if it's a big city, a large clinic, and also not-for-profit organization. She could have been short-staffed and have a multitude of reasons why she did not have the time to fully assess this patient. But I think that the physician should have taken the time to fully assess, and she does have an ethical obligation to admit error because this patient came to her to be treated. The doctor has an obligation to do a full assessment to rule out other infectious processes and investigate other injuries because this patient fell and was presented with cuts and bruises. She should have taken into consideration the patient's lifestyle and treated appropriately. The big question is, could have this situation been prevented? It's possible. I think the physician should have treated this patient more extensively, thinking that this patient is probably going to go back to this environment full of bacteria and be more susceptible to infection due to his open wounds. She should have provided him with more instruction on his activity due to limitations and wound care, along with signs and symptoms of when to return to the ER or go back to the clinic if he is having a fever, having increased pain without any control of his medications, and if he's having any wounds that look infected. And that concludes my case study.